Harvard researchers tracked 31,925 men for 18 years and discovered something that will make you rethink everything you know about prostate health. Men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to those who only managed 4 to 7 times monthly. Evidence strongly suggests your body is not asking you to slow down. It is signaling you to keep the plumbing running. If you are over 50 and experiencing dry orgasms, reduced fluid, or avoiding ejaculation altogether, this information is associated with reduced risk and could genuinely change your health trajectory. I am a urologist, and I am about to share information that most men have never heard, including what happens inside your prostate when you stop using it, why your body starts recycling fluids in ways that could spell trouble, and the exact steps to reverse course starting today. Comment the word active right now to receive my free 30-day workout plan designed specifically for men above 50, and let us begin. The science behind the silence. Here is something fascinating that most medical professionals never take time to explain properly. Your prostate gland is essentially a factory that never stops production. It continuously manufactures prostatic fluid, which makes up approximately 30% of your ejaculate. The seminal vesicles contribute another 60%, while the remaining 10% comes from the testicles and other small glands. When you do not ejaculate regularly, that fluid does not simply evaporate. It accumulates. The prostatic secretions contain compounds like citric acid, zinc, and enzymes that are designed to be expelled from the body. When they sit stagnant, researchers believe this creates an environment of cellular stress and potential carcinogenic buildup. Think of it like a swimming pool that never gets drained. Eventually, things start growing in there that you definitely do not want. Medical researchers have a term called prostatic stasis, and it is exactly what it sounds like. When fluid accumulates in the prostate without regular release, several problematic processes begin. First, the concentrated secretions can crystallize and form tiny calcifications called prostatic stones. These are more common than you think, with studies showing up to 75% of men over 50 have some degree of prostatic calcification. Second, the smooth muscle tissue of the prostate requires regular contractions to maintain proper tone. Just like your biceps will atrophy without exercise, the muscular components of your prostate and pelvic floor weaken without regular activity. A 2016 study published in European Urology demonstrated that ejaculatory frequency directly correlates with prostatic muscle function and overall gland health. Now here is a crucial distinction that confuses many men. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure governed by your brain and nervous system. Ejaculation is the physical act of expelling fluid. Most of your life, they happen seamlessly as one event, but they are driven by completely separate mechanisms. When you experience what doctors call dry ejaculation, you feel that characteristic pleasure, but little to no fluid is released. It is often described in my office as an empty orgasm. This does not mean you have lost your virility. It simply means part of your body's delivery system has a specific, identifiable reason for the change. And that reason is almost always treatable. The 4 hidden causes your doctor might miss. Let me explain what is actually occurring when you experience climax without fluid. There are precisely 4 distinct mechanisms that can cause this, and understanding each one is crucial for addressing the problem correctly. The most common cause is retrograde ejaculation, and I want you to picture this scenario. At the base of your bladder sits a small muscular sphincter called the bladder neck sphincter. During normal ejaculation, this sphincter clamps shut like a traffic gate, forcing all fluid to travel forward through the urethra and out of the body. In retrograde ejaculation, this sphincter fails to close properly, and the fluid takes the path of least resistance straight backward into your bladder. You still experience the full neurological sensation of orgasm because climax and ejaculation are controlled by entirely different systems. The giveaway clue is cloudy urine immediately after intimacy. That cloudiness is literally your ejaculate mixed with urine, and while it sounds alarming, it is generally not dangerous. Common causes include prostate surgery, which affects up to 75% of men who undergo transurethral resection of the prostate. Medications are another major culprit, especially alpha blockers like tamsulosin prescribed for benign prostatic hyperplasia. Diabetes is a sneaky cause that many men overlook because prolonged elevated blood sugar damages the autonomic nerves that control the sphincter. Different from retrograde ejaculation is true anejaculation, where absolutely no fluid is produced at all during climax. This represents a complete failure of the ejaculatory reflex and typically indicates more significant nerve damage or severe hormonal deficiency. The distinction matters because in retrograde ejaculation, the factory is working, but shipping is misdirected. In anejaculation, the factory has essentially stopped production. Causes include spinal cord injuries, multiple sclerosis, Parkinson's disease, and extensive pelvic surgery that damages the hypogastric and pelvic nerve plexuses. Certain medications, particularly selective serotonin reuptake inhibitors used for depression, can suppress ejaculation entirely in some men. Now, if you have noticed your volume shrinking year by year, or if climax feels weaker than it used to, this next part is critical. Do not skip ahead. Your ejaculatory ducts are tiny passages, only about 2 millimeters in diameter, that carry fluid from the seminal vesicles through the prostate and into the urethra. When these ducts become blocked, production continues normally, but delivery is impossible. It is like having a garden hose kinked at one point. Water pressure builds behind the obstruction, but nothing comes out the end. Causes include chronic prostatitis that leaves scar tissue, prostatic cysts, and calcifications that physically obstruct the narrow passages. Symptoms often include discomfort during climax, a sensation of pressure in the pelvic region, and progressively decreasing ejaculate volume over months or years. The good news is that transurethral resection of the ejaculatory ducts is a minimally invasive procedure with high success rates for restoring normal flow. Here is something that shocks many men. Testosterone is not just about desire and muscle mass. It directly regulates the secretory function of your prostate and seminal vesicles. When testosterone drops below optimal levels, these glands literally produce less fluid. The factory slows down. Low testosterone affects approximately 40% of men over 45 to some degree. Symptoms extend far beyond sexual function to include fatigue, depression, loss of motivation, decreased bone density, and increased body fat. A simple blood test measuring total and free testosterone can identify this deficiency. If confirmed, testosterone replacement therapy through gels, injections, or pellets can restore function across multiple systems, including ejaculatory volume. However, and this is extremely important, testosterone replacement should only be considered after proper testing and under direct medical supervision. This is not something to self-prescribe or obtain without professional guidance. The surprising factors sabotaging your system. Research published in 2023 in the Journal of Sexual Medicine revealed something remarkable about prostatic drainage and inflammation. Investigators found that men who maintained regular ejaculatory frequency had measurably lower levels of inflammatory markers in their prostatic fluid compared to men who ejaculated infrequently. Specifically, levels of interleukin-8 and prostate-specific antigen in expressed prostatic secretions were significantly elevated in the low-frequency group. What does this mean practically? Chronic low-grade inflammation in the prostate is associated with increased risk of benign prostatic hyperplasia symptoms and may play a role in prostate cancer development. Regular ejaculation appears to be one of several protective behaviors that helps flush out these inflammatory compounds before they can cause cellular damage. Think of it as preventive maintenance for your most vital male gland. If you are taking medications for common conditions, there is a strong possibility one of them is affecting your ejaculatory function without you realizing it. Alpha blockers for prostate enlargement are the most frequent offenders, but the list extends much further. Antidepressants, particularly selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, delay or completely prevent ejaculation in up to 60% of users. Blood pressure medications, including both alpha blockers and some beta blockers, relax smooth muscle throughout the body, including the ejaculatory system. Antipsychotics, opioid pain medications, and even some antihistamines can interfere with the complex neurological signaling required for normal ejaculation. If you have noticed changes that coincided with starting a new medication, this is essential information to share with your doctor. Here is something remarkably simple that significantly impacts ejaculatory volume. Hydration. Seminal fluid is over 96% water, and chronic mild dehydration directly reduces the volume your body can produce. Many men over 50 do not drink adequate fluids because their thirst sensation diminishes with age. Your seminal vesicles and prostate require adequate systemic hydration to manufacture their secretions. The practical solution is equally simple. Aim for at least 8 glasses of water daily, more if you exercise or live in hot climates. Reduce excessive caffeine and alcohol, both of which act as diuretics. Within days of improving hydration, many men notice improvements in ejaculatory volume. Zinc is absolutely critical for prostatic function and seminal fluid production. Your prostate concentrates zinc at levels 10 times higher than any other tissue in your body. Studies have demonstrated that zinc deficiency leads to reduced prostate secretion, lower ejaculatory volume, and altered fluid composition. Food sources include oysters, which contain more zinc per serving than any other food, beef, crab, fortified cereals, and pumpkin seeds. Vitamin D deficiency has also been linked to prostate health and hormonal regulation. Low vitamin D levels correlate with low testosterone, and supplementation has been shown to modestly improve testosterone levels in deficient individuals. Your pelvic floor muscles are the unsung heroes of ejaculation. These muscles, particularly the bulbospongiosus and ischiocavernosus, contract rhythmically during climax to propel fluid through the urethra. Weak pelvic floor muscles result in weaker contractions, reduced ejaculatory force, and diminished sensation. Pelvic floor exercises are not just for women or for treating urinary incontinence. A 2019 randomized controlled trial published in Physical Therapy demonstrated that 12 weeks of supervised pelvic floor training significantly improved ejaculatory function in men with ejaculatory dysfunction. The exercises are straightforward. Identify the muscles by imagining you are trying to stop urination midstream. Contract those muscles firmly for 5 seconds, then relax for 5 seconds. Repeat this sequence 10 times, 3 times daily. When to worry and when to relax. While most causes of dry ejaculation are benign and treatable, certain situations require immediate medical attention. Do not wait if you experience any of the following. Blood in your ejaculate, even if it only happened once, warrants evaluation to rule out infection, inflammation, or rarely, malignancy. Sudden complete absence of ejaculation accompanied by loss of sensation in the genital region could indicate neurological compromise requiring urgent assessment. Pain during ejaculation, particularly if severe or radiating, suggests possible infection, obstruction, or other pathology. Fever accompanying any ejaculatory changes indicates possible infection that needs antibiotic treatment. If dry ejaculation appears suddenly and without explanation, especially if accompanied by these symptoms, do not wait. These are signals that require an urgent urological evaluation. Conditions like certain neurological diseases, uncontrolled long-standing diabetes, or in rare cases, specific urological cancers can interfere with the plumbing or nerve signals. Let me address something that many medical videos ignore. The psychological impact of ejaculatory changes is profound and legitimate. Many men internalize these changes as evidence of declining masculinity or failing health. Anxiety builds. Avoidance of intimacy develops. Relationships suffer. Understanding that ejaculation and masculinity are not synonymous is the first step toward mental relief. Your ability to experience pleasure, achieve erection, and satisfy a partner remains largely independent of ejaculatory volume or force. Orgasm is a neurological event that can remain completely intact even when mechanical ejaculation changes. Communication with your partner is essential. Most partners care far less about ejaculatory volume than men assume. Openness about what you are experiencing often strengthens intimacy rather than weakening it. The most important step to breaking this cycle is information and communication. Understanding that this is a physiological change, not a personal failure, lifts an enormous weight. Your complete recovery roadmap. Depending on the underlying cause, multiple effective treatments exist. For retrograde ejaculation caused by medication, simply changing to an alternative medication often resolves the problem completely. For cases caused by surgery or diabetes, medications that increase bladder neck tone, such as pseudoephedrine or imipramine, can restore antegrade ejaculation in many men. For ejaculatory duct obstruction, transurethral resection of the ejaculatory ducts is a same-day outpatient procedure with minimal recovery time and high success rates. Ultrasound and magnetic resonance imaging can precisely identify the location and nature of any obstruction before treatment. For hormonal deficiency, testosterone replacement therapy offers improvement when properly monitored by a qualified physician who can assess your individual risk factors and track your progress through regular blood work. For weak pelvic floor muscles, physical therapy with a pelvic floor specialist can provide targeted exercises and biofeedback training to strengthen the muscles responsible for ejaculatory force. Here is exactly what I recommend you do after watching this video. First, honestly assess your ejaculatory frequency. If you have been avoiding ejaculation due to changes you have noticed, understand that this may be making things worse rather than better. Evidence strongly suggests that regular prostatic drainage is one of several protective behaviors for long-term prostate health. Second, review your medication list. Identify anything you started around the time changes began and discuss alternatives with your doctor. Third, schedule a basic blood panel including testosterone, prostate-specific antigen, and basic metabolic function. This provides baseline information that guides any necessary treatment. Fourth, increase your water intake and assess your zinc consumption. These simple nutritional changes often produce noticeable improvement. Fifth, begin pelvic floor exercises today. Even without an identified weakness, these exercises maintain optimal function and prevent future decline. Gentlemen, your body is not betraying you. It is communicating with you. Dry ejaculation, reduced volume, and other changes are signals that deserve attention, not shame. The vast majority of causes are identifiable, treatable, and absolutely compatible with a satisfying intimate life for decades to come. The Harvard data strongly suggests that regular ejaculatory activity is associated with reduced prostate cancer risk, maintained muscular function, and lower inflammatory markers. This is one of several important protective behaviors for the body you want to carry forward into your 60s, 70s, 80s, and beyond. Comment the word active below to receive my free 30-day workout plan designed specifically for men above 50, and tell me where in the world you are watching from. If you learned something valuable today, hit that subscribe button and share this video with another man who needs to hear this message. Your health, your vitality, and your confidence are worth fighting for. Now go take action.